Okay, so I'm Erica, the owner of Love Reigns Medical Training Center here in Gainesville, Florida. And I always come in and try to respond to questions that I receive through my videos or on my website or on my TikTok page or my Facebook page. So one of the questions that I just got was, can you please go over what skills are required on the CNA exam prep exam, okay? So let's talk about that real quick. So there's about 22 skills that you would need to know. Okay, so I am in the state of Florida. In the state of Florida, you can challenge the CNA exam 3 times, up to 3 times. If you fail after the third time, you are required to take a 120-hour course. Okay, so we want to make sure that we pass. Okay, I offer the CNA exam prep course, meaning that you come in and I go over everything that you would need to know to take and pass that exam. There are 2 parts. There's a written and there's a skills portion. So the question that I received was, can you review the clinical skills? And so let's talk about that, okay? So there's quite a bit. So I want you to know that there are 22 skills. I'm gonna go through this list pretty quickly. There's a few things that I'm probably gonna add in that you might want to know about certain skills, and there are skills that they use more often than not. Okay, so understand that. Yes. So let me just tell you, as part of the exam, something in my eye, y'all. Sorry. As part of the exam, you have to know all 22 skills. Now, you're only going to be assigned 3 skills. And I say 3 skills plus hand washing, because hand washing is a skill itself, but it's automatically included. Okay, so you got to just know in your mind there are 3 skills and hand washing. Okay, hand washing is pretty important. So, here on the list, the first skill that's listed here, and I am on the Prometric website, prometric.com, is hand washing. And so, that is one of the skills you would definitely need to know. Really quick, I'm gonna touch on really quick what will fail you in that skill. If you do not scrub your hands for 20 seconds, the rule is that you must apply friction for 20 seconds. If you go under that, you will fail that skill. So make sure that if you have to do hand washing, that you do not forget to scrub your hands for 20 seconds, and also do not touch the water faucets with your hands after you're done. You have to use a napkin to turn off the knobs, okay? That will fail you if you don't. Okay. Indirect care is listed here. So indirect care meaning all the things that's not direct care. How you doing? Are you okay? Are you feeling weak? Let me know if you're feeling uncomfortable. That is indirect care. So trust me, you're gonna really need to be aware of everything that you're doing with your patient in those skills. And let me just tell you, in those skills, you have to treat them as 3 separate patients. Okay, so yes, you got to knock on the door and do all the things 3 different times, like you're going into 3 different rooms. Some people get confused about all the things. So the hand washing, all that is going to be a part of every skill. Understanding that with the hand washing, though, they are going to say that you can simulate hand washing at a point. That just means that you don't have to do physical hand washing, but you're still going to go to the sink and simulate it. Pretend that you're doing hand washing. Just stand there for a second and then go get your supplies, okay? But indirect care is super important. Did you greet the resident? Did you provide explanations to the resident? Things like that, okay? So indirect care is very important, and that is a big part of the exam, okay? Next thing I have here is assist a resident needing to use a bedpan. I don't see that one as often. That will be a real patient in the bed, but it will be a student that's playing the role. They will be enclosed though, so understand that you could assist a resident needing to use a bedpan. I don't see that too often. Okay, ambulate the resident using a transfer gait belt. That is a very popular skill. You will need to know how to ambulate and transfer a resident using a gait belt. Your most important 2 things that I would say for that is to make sure they have on shoes and to make sure the gait belt is not too tight. So you have to do the 4-finger check to make sure that it's not pinching your patient. Okay, so you need to know that one. Next up, you need to know is assist a resident needing to use a bedpan. Okay, I'm sorry, that's a continuation. Change bed linen while the resident remains in bed. Okay, that's making an occupied bed, meaning the patient is in the bed and you're changing the sheets while they're in the bed. Okay, making sure they're not close to the edge as you're moving them back and forth. Change a resident's position to a supported side lying position. You're pretty much going to turn the patient on their side. You got to learn a lot. It's a lot, but a lot of this stuff carries over. So you just got to understand what things are repetitive in those skills so you don't get overwhelmed with it all, okay? Dress a resident who has a weak arm. Super important that you make sure that on this skill, I want to make sure you know that when you're done with that skill, that the call light is in the strong arm, okay? Not the weak side. That will be a fail if you leave the call light in the weak. Next up is empty contents of a urinary drainage bag. Super important that you don't grab the the graduate without gloves, and that you make sure you don't expose the opening of that catheter port to touch anything that will cause bacteria to be transferred, okay? Next up is we got that one already. Feed a resident who is sitting up in a chair. You will get that one. That one don't require you to close the curtain because we eat in a social setting, so you don't have to close the curtain. Some of this is carrying over. Measure and record a resident's respiration. So you want to make sure you do it for a full minute. That will fail you if you do it less than 60 seconds. And also measure and record a patient's pulse, okay? The radial pulse. The radial pulse is always the thumb side. If you ever get confused about where to check for the pulse, always thumb side, okay? Provide catheter care to a female resident. Those are very popular skills. Most people are gonna see catheter care. You're gonna see empty a urinary drainage bag, ambulate a patient, ambulate a resident, range of motion. Those are pretty common ones. Checking a pulse, checking respirations. Those are very popular skills. Okay, so don't be surprised if you get that. Provide foot care to a resident. Provide mouth care to a resident who has dentures. And then provide mouth care to a person with real teeth. Those are all skills that you could possibly see. So keep in mind, you may have to brush the student's teeth that you are partnered with. Some people get a little, worked up about that, but that is a skill that you may see. Provide perineal care to a female resident who is incontinent of urine. Okay, these are pretty. I say if you are very overwhelmed, the bath skills are your most heavier skills. I would say they are the ones that require more steps. Also, make sure you learn the supplies, because they won't give you the supply list at the test site. Again, I am in Florida, so keep in mind I am in Florida. Provide resident with hand and nail care. Okay. That's not a bad skill. Some of these skills are not really bad. You just got to learn them, okay? Provide a resident a partial bed bath and a back rub. I haven't seen that one, but you possibly could get it. Range of motion. So out of these 22, a couple of these skills are repetitive. Like provide range of motion to the elbow and wrist. Provide range of motion to the hip, knee. Same skill, same thing per se, but a different area of the body. So those are all different. Those are pretty much the same type of skill to the hip, knee, and ankle. Also, transfer the resident from bed to chair. That's a pretty popular skill, and you better not forget to put those patient's shoes on, okay? You will fail. And also, don't forget to lock the wheelchair. If you forget to lock the wheelchair, you will fail that skill, okay? I'm going through this pretty quickly. My time is about to run out. Hold on, let me see. That's the one we just did. Okay, that's it. I went through them pretty quickly. Those are all the ones. Range of motions, feeding the resident, up and all the things. So really quick, skills, listen, you got to know them all. Understand that a lot of that stuff is repetitive. Study only a few a day, and don't be looking at a lot of, I use 4-year CNA. That's who I use as my curriculum. Now everybody use different ones. All I say is if you're going to whoever you use, be consistent. I think it's not a good idea to use a lot of different versions of the training. And everybody's trainings are different. So I have people all the time reach out to me about things that I'm doing, that we're doing in our classroom. But if you're in another state, understand that Prometric do not require for Florida to raise the bed during the skill. We do not have to raise the bed for the skill. So people comment and say, "Oh, you didn't clean the port with the alcohol in the catheter bag." We're not required to do that. Also, you have to document some skills. You have to document anybody how much they ate. Those are skills that will be included with your skill is documentation on the emptying the drainage bag, how much they ate, and the vital signs. Those are skills that you will have to document on. So just listen, don't get overwhelmed at all. You got this. You got this. You can do that. Do a couple skills a day. Don't overwhelm yourself, and in the process, make sure you are memorizing the supplies, because they won't tell you the supplies. I hope this helps somebody. Listen to questions below. Talk to y'all soon.